Loose bodies are one of the classic indications for arthroscopic surgery of the elbow. A loose body is a small piece of bone and cartilage which has broken off from the rest of the elbow joint because of trauma or arthritis and is now freely floating, every once in a while getting caught in the joint, causing the patient to have pain, clicking, and locking, which can be very sudden. The loose body can continue to grow because of the live cartilage cells still attached to it, which can deposit more cartilage and bone on the outside as time goes on, much like a pearl might develop around a grain of sand within an oyster. This case is an 18-year-old patient who 4 years prior had a minor fracture to the left elbow which healed completely, but over the last year has developed worsening symptoms of pain and clicking almost on a daily basis now. The x-rays from the lateral and the anterior-posterior view demonstrate this large loose body in the posterior joint, as well as calcium in the region of the MCL or medial collateral ligament indicating his prior injury. The daily symptoms have caused the patient to now wish to have arthroscopy, which is being shown here. The front half of the joint is first inspected to ensure that all cartilage surfaces are intact and that there are no loose bodies here. The rotating structure there is the radial head, and this knob-like structure in the bottom right corner is the coronoid, which is being moved up and down as the elbow flexes and extends. The lateral half of the joint is entered with a needle to confirm correct placement of an arthroscopic portal. The knife is used to create this portal, which is actually a 1 centimeter incision, which allows placement of other instruments to aid the examination and performance of this surgery. This instrument is a 3.5 millimeter diameter shaver, just to give you some perspective of size here. It's used to clean out the synovium, which is this friable loose tissue lining the front of the joint, which allows for better inspection of the entire joint. The portals are switched and the other side of the joint is now inspected, in this case the medial side. Once again, this confirms that the cartilage in the front half of the joint is healthy and that there are no loose bodies here. The loose body is in the back half of the joint, which is seen here in the top right corner of the screen as some of the synovium is being removed. The posterior medial gutter is entered and a stress exam is performed to ensure that the MCL is still intact, even though there is some calcium in it on the x-rays. The main loose body again is here in the posterior compartment of the elbow, and it's so large that it's dominating the entire field of view. And it's hard to see without backing the camera way up. It's so large that in fact it's very difficult to remove it with this standard grasper. And so an osteotome, which is a small chisel-like instrument, is brought into the joint and is used to fracture this large loose body into smaller, more manageable pieces. In this case there will end up being 3 pieces. 2 of the large pieces are seen here, and there's a third smaller piece. As each of the pieces is being individually removed, you can see the cut cross-section of each loose body, which has a sort of a cut onion appearance. And this shows how more cartilage and bone is deposited on the outside of the original loose body with time. The second piece is being removed here with a large grasper. Finally, the last and smallest fragment is removed with ease. All pieces are reassembled on the back table to confirm that the entire loose body was removed, and then the joint is re-entered to inspect the posterior lateral gutter here. The radial head is seen directly ahead, and the ulnohumeral joint to the right. A stress exam is performed here to confirm that the lateral elbow is stable. And at the conclusion of the arthroscopy, there are 4 small incisions around the elbow, each closed with 1 stitch, which can be removed in about a week. Typically, the patient is allowed a free and unrestricted use of the arm, though it may hurt for the first day or 2. And typically by 6 to 8 weeks after the surgery, the patient is able to resume all activities of daily living, which include manual labor and even vigorous sports activities. Well, thank you for your interest, and to learn more, join us at www.nwoa.com.